path. How did you arrive at this job you have now?
Well, it was an interesting path, and I don't think I ever thought that I would end up here. I began as a family physician and finished my training out in the University of Washington system, and at that point recognized that medicine was changing and that physicians really had to understand the organization of medicine as well as the administration and financial aspects of medicine. So I did an MBA at the University of Washington. As well as that, I did a fellowship in faculty development at the same time to pay for it. And with that came out and decided to work in a rural health clinic in the Adirondacks of New York. And from there moved to a position with a 501c3 health maintenance organization in Vermont, where we ran a rural health maintenance organization, both a staff model with our own doctors' offices where I practiced, as well as with contracted doctors in the university. So got very involved in that point of administration of health systems, as well as all the medical aspects of running a health plan. Kaiser acquired our plan after that, and I stayed with Kaiser, an excellent organization, for a number of years. And then Kaiser found itself in a position where it had to move back out of New England. So I took a sabbatical at that point. Traveled around the world with my kids, backpacked around the world, and had a wonderful time. And came back and just started consulting on quality improvement work and on preparedness for different health plans and hospitals around requirements on their services. And then got a call on a Sunday morning. The governor's looking for a health official. Would you consider it? And that was like, wow, that's kind of interesting. So I called a friend of mine who I knew the governor, and I said, you know him and you know me, would it work? And they said, well, we'll talk to him. And a week later they offered the position, and I started as a health commissioner in Vermont, which was a fascinating position, a wonderful platform. And I have to say it felt really good after having been in the insurance world to coming to being health commissioner, because now I was seen as a good guy. No, same person, different role. And after spent 3 years in Vermont as the health commissioner, and I'm very proud of some of the work that was done at the department while I was there, including expansion of methadone programs, take-home methadone programs. We created the state's first inpatient rehab for drug and alcohol for women and adolescents. And then we started the Vermont Blueprint for Health, which I think is a model in the country for creating a very competent chronic disease management system at a state level. I was on the board of ASTO, and the position opened up, and I got offered the position here. And that's also been a wonderful experience, working with health officials across the country and working with APHA, as well as many folks within the administration to represent state public health.
So what is your typical day like?
Yeah, it's hard to imagine what typical would be. There isn't much that is typical, but we are a very high service organization, so we have the 59 leaders of the state, Washington, D.C., and territorial health agencies, and we're available to them 7 days a week, 24 hours a day. So we get involved in supporting the health officials, and again, that could be any day of the week, any time of the day. It could have been the pandemic, it could be the Gulf oil spill, it could be anything really. So it's not clear what typical is, but probably the most important thing we do is to support the state health official and the team around them, so that the 100 to 120,000 people working in state public health are well led and well managed. And then we do a lot of representation of the state health agency's interests in Washington with different branches of the federal government and the administration, as well as, of course, the Congress. So it's a very rapid-paced position and very exciting.
What was the most important in your work and education to get? What was most important in your work and education to get where you are today?
You know, it's an interesting question, but I think that gaining experience in different sectors, if you will, was important, because although it sometimes is very difficult to understand. For example, I had never taken a business course when I started the MBA program, and it would take me a couple weeks to figure out what microeconomics was. On the other hand, it opened up a whole new part of the world to see how people with that business and an organizational background look at things, which is very different than the way you look at it as a practicing physician. And then over time, getting involved in the running of the health plan with the big employers out there to understand how employers look at healthcare. Our board of directors had to be 52% members in that HMO, and so how does a consumer look at healthcare? And then I worked in the FQHCs and with immigrants and refugees. I worked in a homeless shelter for adolescent kids who mostly had drug and alcohol programs, in an inner city school as a doc, and could really see all strata, if you will, of our socioeconomic status in this country, to gain a real appreciation for those people who are born into a disadvantaged situation. And then coming into public health, what a wonderful platform to step back from day-to-day patient care and look at how do we change systems and policies so that everyone's boat gets floated a little higher, as opposed to just working one patient at a time. So I think that variety of experiences, for me, creates a lot that can be drawn upon in a given situation. You can look at it one way, and if it doesn't work, you try looking at it another way. If it doesn't work, you try looking at it another way. And I think that, to me, has been that experience in a number of different areas has been what's been most important.
What major challenges do you see coming in your line of work or in the field of public health today?
Yeah. Well, the thing that is on all our minds, of course, is health reform, and the Supreme Court 2 weeks ago upheld the ACA in large part, and that is both a tremendous opportunity if we fully realize the potential for prevention in the Affordable Care Act and in health reform. But on the other hand, we see that on a daily basis, the Prevention of Public Health Fund is under attack, and we need to defend it. We also, potentially could have tremendous benefit if the clinical sector gets involved in what they're calling population health, in terms of expanding our army of people working on population and public health. But that, again, is a tremendous challenge as we try to reach common ground in what's really a cross-cultural engagement with the clinical sector. Public health and clinical medicine use very different data sets and definitions and languages and approaches to the world. And so a lot of the work that we're engaged in is in trying to bring those two worlds together into an overall health system rather than a health care system and a public health system. So that the great potential and potential threat of health reform is what we work on. And on the threat side, the threat we face is if there's a thought out there, well, now that somebody has an insurance card, you don't need public health anymore. And that line of thinking really is that limited thinking of everything can be done in the four walls of a hospital or doctor's office. And we in public health know that's simply not true, and that the vast majority of what leads health occurs outside that 8-minute visit and those four walls of the doctor's office. But we're going to have to continue to make our case within the overall health system. And the other issue, of course, is the budget right now. We're facing in January a potential sequestration of 7 or 8%, which could lead to a devastating blow to the already dramatically declining public health budgets and staff out there.